Hi, I'm Dr. Emily Richardson, and I'm an optometrist for KSB Lawless Eye and Vision Center in Dixon, Illinois. And I'm here today to talk to you a little bit about inflammatory eye disease. Inflammatory eye disease is a very broad topic that covers many different eye conditions. And it's really prevalent that we're talking about it right now because this week is the 2024 Inflammatory Eye Disease Awareness Week, as listed by the Prevent Blindness Organization. So it's a good way to get people talking and learning a little bit more about what inflammatory eye disease is. Inflammation, as we know throughout the entire body, can be found in the eyes just the same as anywhere else, in our joints and in our bones and in our bodies. And inflammation in the eyes can be in the eyeball itself, it can be in the eyelids, or it can be in the area surrounding the eye. And inflammation happens or occurs in response to many different things, including infections, allergies, systemic conditions like autoimmune disorders. It can be related to an isolated event like an issue with your contact lens wear, an injury, or a trauma. And there's many different things that can lead to inflammation of the eyes. And we have to use different tools to diagnose what the cause of that is, and we can then treat it appropriately. So inflammatory eye disease, there's a long list of different types of inflammatory eye disease here, but really it just gets broken down to what part of the eye is being affected at that time. So as you look in the picture here, this is a cross section of the eye, and the list kind of goes in order from the front or the anterior portion of the eye towards the back of the eye. So the front of the eye, which starts with the eyelids and the eyelashes and the cornea, the part of the eye that we see through. And so inflammation there is called keratitis or conjunctivitis or blepharitis. As you move further back into the eye, it can affect the spaces or structures filled with fluid of the eye, or even to the way back of the eye where it can affect the retina, the tissue that does all of our sight. That's called posterior uveitis, retinitis, or even the optic nerve that connects our eye to our brain, called optic neuritis. Now, this is a long laundry list of different conditions, but really the idea of what I want to talk about today is what would you notice and who could be affected by these conditions. So the population or the patient group that usually is affected by this, it can be anybody at any age. It can be children, it can be geriatric population, but for the most part, the majority of patients are individuals in their working age group, so in their 20s to their 60s. And that plays along with the fact that a lot of these conditions, the cause of that can be systemic and be related to autoimmune conditions or other infections that you get in those periods of your life. But again, anyone of any range can get that. Similarly to, like I said, in relation to the causes, females often are more inclined to get that over males just because of those autoimmune conditions. But again, we see this in individuals of both male and female gender. So what are we looking for? So if in your eyes you're having any of the conditions or symptoms like redness, pain in the eyes, light sensitivity, those are the three main things that we see with inflammation or swelling in the eyes. When we see that in the front of the eye might be red on the surface, and that would cause pain. And the light sensitivity or achiness when you have light coming into the eye is also because the muscles or the structures inside the eye are swollen, and that makes them sensitive to move. If you think about how our eye works, when light comes into the eye, the iris, the colored part of the eye, constricts, and that muscle, if it's swollen, would hurt to constrict, much like it would hurt to bend your arm if your arm has swollen or has an injury there. So those are the different things we see with inflammation or swelling in the front of the eye. The front of the eye, if swollen, can also lead to blurry vision because the cornea, that central tissue that you're looking through, or the anterior chamber, the clear fluid that you're looking through at the front of the eye, if it's got inflammation, we actually have white blood cells that can flow or infiltrate into that area, and that can cause blurry vision. Furthermore, as the inflammation goes deeper into the eye, whether it be in the vitreous or in the retina, you might get blurry vision or even dark spots like floaters that you can see if those tissues are affected. The onset of these symptoms, so inflammation, depending on where or what part of the eye it's affected, can come on either acutely, meaning you have all of a sudden it comes on very quickly, and it seems to not be waxing and waning. It's very intense and very constant. And until we have treatment, that will stay that way. It could also come in waves where it's maybe not as severe, and it comes and then it maybe goes away and then it comes again. And that would be more recurrent inflammation. And then the other type, the unfortunate for some people who have it this way, is you could have chronic inflammation where the symptoms come and they persist and they stay despite treatment for months, even up to 3 months at a time when you're having a specific flare-up. And the type of inflammation, whether it be acute or recurrent or chronic, also depends on what the cause is. So really, being able to see an eye care provider and even your primary care provider in conjunction with that to determine the cause is really what's necessary, so we can figure out the appropriate treatment for that condition. So what should you do if you're having these symptoms? Obviously, the biggest thing is having a comprehensive eye exam, having your eyes evaluated by an eye care specialist, both the front of the eye and having a dilated exam to evaluate the back of the eye are very important with these types of symptoms and looking for these types of conditions. Inflammatory eye disease, like I said, can affect any aspect of the eye. The front of the eye would be very noticeable, not just symptoms, but also visibly with redness and swelling. And if you have inflammation or inflammatory eye disease that's affecting the back of the eye, you might not see it outright on your face, but you would be having other symptoms like floaters and blurred vision. And that would only be able to be detected by the dilated eye exam. And so when you come in for an eye exam, especially if you're specifically looking for these types of symptoms, you would, all parts of the exam are important, especially an extended medical history, because we need to know what sort of conditions you might have. We need to know what sort of treatments you maybe are on, other infections or injuries that you've had previously. We then would, of course, look at the eyes, check your vision, check your peripheral vision, and go on through the different steps of the exam to evaluate those conditions. If it's in the retina, we also have some special imaging that can be done in an optometrist or an ophthalmologist office that would actually measure for inflammation in the tissue in the inside of the eye as well. When we're looking for causes, you might find, and it's not uncommon for us to request lab testing, whether we done, at the lab or through your primary care provider, because some different infections or systemic conditions can cause this inflammation. And so to find the true cause, that might be necessary. How do we treat inflammation in the eye? So when we talk about inflammation that affects the front of the eye, the main thing we think about is drops. So steroids or corticosteroids that are in a drop form that can be used as an eye drop to reduce the inflammation on the front of the eye is one of the main treatments. We also use dilating drops, not just while we're looking in the eyes, but also as a treatment, because like I mentioned before, if the eye is swollen and that the iris, the colored part of the eye, is having to open and close with changes in light, by dilating it, that will stabilize that tissue, allow it to heal better, and prevent the swelling. Also, inflammatory eye diseases can cause elevations in your eye pressure. And so to reduce the pressure and prevent risks of glaucoma or other pressure-related issues in the eyes, we sometimes have to use drops to lower your eye pressure during that course of treatment as well. If the inflammation is deeper in the eye and the topical drops that you'd put on the surface won't help, there are other antibiotics, antivirals, or oral medications like steroids that can be used to treat you systemically. It depends on the cause of that inflammation. We are finding that there are some other non-steroidal drops that can be used. For example, Humira is a drop that can be used for inflammation of the eyes as well, and that's always changing, and we're always researching and doing studies to try to find other treatments other than steroids to treat these conditions. What it comes down to is, what do I do if I have these symptoms? And the big importance is having a routine eye exam, especially when you're having symptoms, but also just to take care of your eyes on a regular basis. Eye exams are not only for determining whether you can see 20/20 or do you need glasses, but eye exams are important to check the health, and annually for patients is appropriate. If you're having a problem, the first thing you should do is seek care. Do not ignore your symptoms. Light sensitivity, blurred vision, redness can be a host of different things, and specifically can be caused by these inflammatory eye diseases, some of which, if not treated, could lead to blindness or loss of vision. And so it's important to take care of your eyes and seek attention if you're having these issues. I have a couple references here, mostly for the images, but again, it references back to that Prevent Blindness website, the organization that's really trying to promote and generate awareness for these conditions. If you have any other questions, these are some of the references I have. As always, if you're needing any eye care services or you're having a problem with your eyes, please do not hesitate to reach out to our office, Lawless Eye and Vision Center through KSB. I am one of 3 optometrists at that location. We're all accepting patients and are willing to see you, especially if you're having an eye issue, but also for routine eye care. Thank you so much for your time today.